It was a year ago this month when the United Nations High-Level Panel on Access to Medicines published its report. And the report was pretty stark. It suggested that the pharmaceutical industry was largely out of control, that there was excessive patent protection, that drug prices were outrageously astronomical, and that we desperately needed the intervention of governments, regulatory and policy to bring the drug pricing landscape under control. Well, in the intervening year, there have been some astonishing drug prices quoted internationally and chronicled to some extent by the excellent NGO Oxfam in a recent report. For example, in South Africa, the new breast cancer drug, Herceptin, costs $38,000 US dollars for a 12-month regimen. That's roughly 5 times the average annual family income in South Africa. In the United States, a recent new drug to treat hepatitis C, when it was launched, cost $1,000 per pill per day. Now, there are 3 million hepatitis C sufferers in the United States, so that works out to over $3 billion a year. And just last month, Novartis announced the first ever gene therapy treatment for leukemia at a cost of $475,000 for the one treatment. Now, where cancer drugs are concerned, in the European Union, they have quadrupled in price over the last 15 years. In the last year in North America, where insulin is concerned, it's gone up between 7 and 10%. And everyone can surely remember exactly 1 year ago the EpiPen scandal, where overnight Mylan Pharmaceuticals increased the price of a packet of 2 EpiPens from $100 to $608. That's over 500% increase. And who sustains all of this? The governments of the United States, the United Kingdom, Germany, Japan, and Switzerland, with a kind of honorable mention for Canada. And why? Because the pharmaceutical industry remains the most powerful lobby in the world, and governments simply don't have the courage to confront it. As a result, a great deal of damage is being done to human health, and that panel report is withering on the shelves. That was last week. I'm Stephen Lewis.